When healthy biology rapidly mutates into a diseased state, the first instinct of many practitioners is to look straight to the natal lagna and the sixth house to predict the physical breakdown. That approach is incomplete. The natal lagna, or swarupa, maps the abstract intrinsic potential of the soul, the who of the incarnation. Diagnosing the physical body requires a lens capable of viewing material manifestation. This diagram illustrates why. While the flat D1 chart maps the soul's potential, the glowing layer rising above it represents the Maya Rupa, the projected material reality where illnesses actually materialize. To decode this layer, we extract the Arudha Lagna, or AL. But acquired disease is only half the medical profile. The roots descending below the chart represent the Upapada Lagna, or UL. This axis maps the genetic lineage, isolating the hereditary conditions passed down through the bloodline. A precise medical diagnosis requires reading all three layers simultaneously. The astrologer must map the constitutional potential, the acquired physical reality, and the ancestral genetic blueprint. To map the acquired physical reality, we first derive the Arudha Lagna. The term Arudha translates to mounted. It marks the exact point representing how the physical constitution navigates and is perceived by the material world. This chart outlines the primary derivation algorithm. We start at the Lagna, here Taurus. We locate the Lagna Lord, Venus, sitting in Cancer. By counting inclusively, we see Venus is 3 signs away from Taurus. We then count the exact same distance, 3 signs forward, from Cancer, landing the Arudha Lagna marker on Virgo. Jaimini astrology dictates that the AL cannot fall on the primordial axis of self versus other, the 1st and 7th houses. The projected material image must remain distinct from the natal ascendant and its opposite point. If the calculation lands on the 1st house, we project the AL to the 10th. If it lands on the 7th, we project it to the 4th. Watch the mechanical shift. When the standard calculation brings us directly back to the 1st house, it triggers an exception state. The algorithm forces the marker exactly 10 signs forward, relocating the AL to the zenith of the chart. Mastering these specific mechanical exceptions is the only way to accurately plot the coordinates of actively acquired diseases. Once derived, the AL redefines the diagnostic value of the 12 rashis. This 3D model categorizes the human body into 4 elemental zones: fire for the head and heart, earth for structure and digestion, air for the nervous and circulatory systems, and water for the lymphatic and reproductive functions. When the AL falls in a fire sign, Aries, Leo, or Sagittarius, it activates an inflammatory axis. An Aries AL points toward head trauma and acute fevers. Leo targets the heart and spine, while Sagittarius indicates hepatic heat and liver disorders. The earth signs, Taurus, Virgo, and Capricorn, govern the structural and metabolic axis. A Taurus AL exposes the thyroid and vocal cords. Virgo points to malabsorption and intestinal distress. Capricorn flags the decay of bones and joints. The air signs dictate the systemic and circulatory axis. Here, Gemini correlates with respiratory distress and asthma. Libra indicates renal imbalance, and Aquarius maps to complex neurological and circulatory disorders. Finally, the water signs, Cancer, Scorpio, and Pisces, regulate the fluid and immune axis. A Cancer AL reveals vulnerability in the stomach and lymph. Scorpio warns of chronic excretory and reproductive infections, while Pisces points towards severe immune collapse. The Arudha Lagna identifies the primary elemental zones where the physical body is most vulnerable to environmental friction or lifestyle stressors. Lifestyle alone does not explain every illness. Tracing diseases that predate the patient's birth requires a pivot to the 12th house, the domain of dissolution, hidden history, and the deep past. This takes us to the Upapada Lagna, or UL. As the Arudha of the 12th house, the UL represents the marital lineage. It contains the genetic inheritance, the biological sequence encoded into the native before they take their first breath. The derivation algorithm perfectly mimics the AL. We start at the 12th house, count the distance to the 12th lord, and project that exact same distance forward. This establishes the UL marker, anchoring the genetic profile. In medical astrology, this marker functions as the primary diagnostic tool for identifying hereditary conditions passed down through the family bloodline. The AL exposes what the patient does to themselves. The UL exposes the biological depths they were born into. Reading a Rashi through the letters of the UL reveals inherited cellular memory, the biological blueprint the native carries from their lineage. To read that memory, we isolate the second house from the UL. This is the Kula, the specific indicator of the bloodline. This table juxtaposes the signs acting as the acquired AL on the left against their function as the genetic Kula on the right. Look at the Gemini row. As an AL, Gemini signifies acquired nervous exhaustion or respiratory distress brought on by lifestyle. In the second from the UL, it indicates a familial history of tuberculosis or genetic asthma running through the lineage. The distinction sharpens with Scorpio. Left unchecked as an AL, Scorpio points to acquired chronic infections or sexually transmitted diseases. But as the genetic marker, it reveals a bloodline pendency toward reproductive cancers and deep-seated cysts. Consider Capricorn. An AL in Capricorn shows wear and tear joint decay, the physical cost of aging and labor. In the second from the UL, it flags congenital osteoporosis and degenerative bone diseases present from birth. By identifying the second house from the UL, the astrologer gains the ability to warn a patient about latent genetic vulnerabilities years, sometimes decades, before they manifest as active symptoms. A complete Jyotish medical diagnosis does not rely on a single data point. It requires synthesizing the intrinsic Svarupa, the acquired AL, and the genetic UL into a unified patient profile. This diagram models that synthesis in action. Here, we have a hypothetical patient profile drawing from two distinct astrological variables, an Aries Arudha Lagna and a Virgo placement in the second from the Upapada Lagna. First, we analyze the Aries AL variable to determine the active lifetime risks. The visual highlights an inflammatory disposition, putting the patient at an acute risk for sudden fevers, head trauma, and severe migraines due to their physical interaction with the world. Next, we trace the Virgo line back to the ancestral risk. This variable flags a different system entirely. It exposes a latent genetic marker for enzyme deficiencies and familial diabetes residing within the patient's DNA. The practitioner now holds two distinct layers of data, an active tendency toward inflammation and a latent metabolic vulnerability. Synthesizing these allows for a preventative care strategy that addresses both the immediate lifestyle risks and the underlying genetic markers. Mastering the Arudha and Upapada Lagnas provides the structural framework necessary to differentiate between what a body acquires through time and what it inherits through blood.